When we decide to undergo a procedure of hair transplantation, the first question which arises in our mind is whether I should undergo an FUT or an FUE, which is the right technique, which would be serving my purpose. Hi, I'm Dr. Mayank. I'm a board-certified plastic surgeon and a diplomat of American Board of Hair Restoration Surgery. I've been running an exclusive trichology and hair restoration practice in New Delhi for the past 12 years. FUT is also called as follicular unit transplantation. We have read enough details about the same. We have been sold different adjectives for the same as well, that it is a primitive technique, it is a technique not being used in today's date. Everything that is associated with this or the other technique has to be transparent in front of you before you take a call what exactly would be the choice of technique for you. Follicular unit transplantation is a technique where we extract a strip from the side and the back of your scalp. The procedure, once performed, it would have a linear scar in the back, which we close with a specialized technique known as trichophytic closure. What this means is that the linear scar that remains in the back of your scalp will also have hair follicles growing through it. The scar will not be visible to anyone in this world till you shave the scalp off or go down to an absolute buzz cut. FUT is not meaning that we are extracting that strip and implanting as a strip. The strip under microscope is further dissected into segments which are called as slivers and which undergo further dissection into individual follicular units. These follicular units are then implanted into the recipient area. In the FUE, which is known as follicular unit excision, what we are doing is punching out individual follicular units with the help of punches. The punches could be manual or motorized, but once these are extracted in the form of the punches, the grafts or the follicular units are going to be implanted in the recipient area exactly the same way, the way we do it in FUT. So anyone who's looking at you from the front will never be in a position to determine you have undergone an FUT or an FUE. Now let's talk about each technique with its pros and cons. FUT, which would be meaning that the strip has been harvested from the safe donor area. The centralmost part of it are the most long-standing hair follicles. The FUT, when dissected, is under vision. That means that the damage rate which is involved in the procedure is less than 1 to 2%. The damage that can happen may be at a stage of extraction or dissection into individual follicles. What is the merit of FUT is the core follicles which we have extracted stay for the longest possible time. Once we have extracted the FUT and that linear scar is there, the rest of your entire safe donor area is virgin for future sessions. That means that we have extensive amount of donor reserves which remain for the future as well. In FUE, when we are punching out follicular units, we are punching out hair in between your existing hair follicles, that is reducing your density and is also leaving the skin as it is, but the hair follicles are harvested. That means the per square centimeter density, what we would have at the end of a procedure of FUE may be 20 to 30% lesser than what we had before. In one session of FUT or FUE, no one can determine that you have undergone anything from the donor area, provided there has been no over harvestation of either of these techniques. If the strip that has been extracted has been taken as a wide strip, it may leave a wide, bad looking, ugly stretched scar. If we have over harvested the FUE follicles in a procedure of FUE, in that case you will see a totally moth-eaten appearance of the scarred donor area. So what we have to balance is what is the minimum that is required for an individual to give a decent coverage and not the maximal harvestation in a single session, which is what is being done in today's date by most clinics. The disadvantages of FUT is because we have stitches in the back, so obviously the recovery is slightly slower, but it is not as painful as what people think. Most of our patients, by the second day of the surgery itself, ask us whether we require painkillers or not. So pain is never a determining factor for most people. Tenderness is definitely more with FUT, where if you touch or rub the part where we have stitches, you may feel the pain and discomfort for about 2 to 3 weeks after the surgery. In FUE, the recovery is faster on the other hand, But what we have to see is actually what is the end result out of a transplant. The post-operative recovery, whether FUT or FUE, is not uncomfortable at all. Another demerit of the FUT procedure is that the measurement of the strip are actually with the guidelines. We cannot go beyond the level of the external auditory meatus or the ears of a patient. When we go in for the width of the strip, the laxity of the scalp is what is actually going to determine how wide a strip is taken. A conservative strip of 1 to 1.5 centimeters on an average will give us around 2000 to 2500 grafts in the normal densities what Asians have. In FUE, the same number of grafts can be extracted in the same donor area with a much wider span of donor being utilized from the patients. So the area what is going to be remaining virgin for the future sessions will be much lesser. With FUT, when we are taking the specific measurements, we cannot extract more number of follicles beyond that limit. If the requirement is slightly more than that, then we may choose to club both the techniques together. The basic idea is we should not be determining a procedure or a technique to give us a result of hair transplant. Every individual is different. Everyone's donor is different. The kind of grade of baldness that runs in your family is different. So for someone who has advanced grades of baldness running in the family, may not be a right candidate to choose any one technique. For such people, to maximize the utility of the same donor area, it is advisable to combine techniques. That gives us the best utilization of the number of follicles. What we also need to be prepared for is maintaining a reserve for the future, what most clinics do not do. If your donor reserve is not maintained in today's date, at some level you will run out of the follicles from your donor area. In that case, you may not have a body hair reserve which matches the texture or the pattern of the scalp donor area. But also along with that, if you even have that kind of a texture and body hair distribution, the aesthetic balance of the scalp donor versus the body hair reserves will never give you the same aesthetics. In FUE, we have a tendency sometimes that we go above the safe donor area or below the safe donor area for harvestation, for which I'm going to demonstrate what exactly is the safe donor area on a dummy for you. When we look at someone who's balding extensively from a grade 6 to a grade 7, the side and the back hair for that individual are usually the relatively non-balding areas. But out of this entire span as well, what we would see on the dummy, the blue marking is something which is suggestive of the relatively safe donor area. So any follicle that we are harvesting out of this safe donor area would be relatively the most long-standing hair on the scalp. In a process of FUT, the strip that we harvest is basically out of the central most part of the safe donor area. So these are the most long-standing hair out of the safe donor area as well. Usually, the width of the strip is harvested on the basis of the laxity of the scalp, that how tight or loose the scalp is, so that the closure is given without any kind of tension. When we talk about FUE, we are punching out hair in between the existing hair follicles. Now, when we are punching out one hair out of every 4 to 5 follicles, that means that you are losing up to 20 to 25% density of the hair in the same square centimeter area of the scalp. What we need to leave behind is something which is very critical, because if we over harvest, in that case you would have gaps which would be visible in the same area. The same strip which would have been a 1 centimeter strip in the center, if is giving us 100% of the follicles, and we are harvesting one out of every 4 to 5 follicles in FUE, we are taking around 20 to 25% of the follicles only. So for giving the same number of follicles, we will have to incorporate approximately 4 to 5 times of the same area for having the scattered harvestation out of. If we exceed the limits of the safe donor area and harvest out of the areas which is above or below this, which most of the FUE surgeons or clinics might do to get the numbers that we need to cover up the extensive baldness, in that case, we may have this part of the follicular extraction, whatever area we have implanted these follicles into, would be disappearing from that area the moment the baldness increases from this part to the safe donor limit. Hence, it is extremely critical that we choose the technique based upon what is the donor to the recipient ratio. If you have a tendency in the family where the reference point is having extensive baldness, please do not jump in for single technique procedures only. It could be a combination of different techniques, but what works the best to maintain the maximum donor reserve for the future is very important for us. For someone who's having minimalistic balding but is at a very young age, should also be very careful, as the baldness might expand into areas which can intrude into the existing follicles, the place where you had not even imagined into. What we need to be careful about is that if we are harvesting FUE out of the safe donor area, we are taking 25% of the density approximately, and there would be some transaction as well, as it is a blind technique and we cannot see the follicles inside the skin. So in total, you are losing up to 25 to 30% of your follicles in a single session. Anywhere where we lose more than 50% of the hair from a specific part of the scalp will have visibility of the scalp in the back as well. So if as a youngster in an age group of 25 to 35 years of age, we are jumping in for the first procedure of FUE and harvesting around 2500 to 3000 grafts, in future, what is remaining in our donor reserve is another 2000 to 3000 grafts at the maximum. What we would be having as a requirement to cover the entire scalp if someone goes to a grade 6 is approximately 10 to 11,000 follicular units, which would always run short if we have chosen the first technique as FUE. So in cases of advanced grades of baldness, whenever the procedure is being done as the FUE as the first procedure or the second procedure, if we run short of the donor area to cover more areas, then in that case we may incorporate body hair harvestation, which could be from the beard, chest, abdomen, back, legs, anywhere. But the best match to the scalp recipient area hair would be the scalp donor itself. So whenever we are looking for balancing the donor to the recipient, it is critical to utilize and plan the donor area in a proper way. If you wish to undergo the FUE procedure, you need to be ready about few things. One, the body hair distribution of the individuals has to be extremely good. You have to be at a relatively stable age of balding. If you are a youngster who's jumping in for an FUE procedure, the donor area reserves what we have for the future may not be adequate to compensate for the amount of recession that can happen as we age. So to summarize, what is the candidature of an individual to undergo an FUT? If you are someone who's young, who's going in for a hair transplant with advanced grades of baldness that runs in the family, then you're a candidate for an FUT according to me. If you have limited body donor reserve available with you, then you are definitely a candidate for an FUT. If you are already at an existing baldness grade, which is at a grade 5 or 6, then in that case, it is advisable to incorporate FUT as a component of your donor area. Combining FUT and FUE will maximize the donor reserves for you in that case. If you are at an age group where you have a stable scalp, maybe at around 45 to 50 years of age, or anywhere above 34-35 where you don't have advanced grades of baldness as reference points running in the family, and you have extensively good donor reserve in terms of the density of the scalp as well as the body hair, in that case you may choose to consider FUE as the choice of surgery as well. More than 95% of the hair clinics in today's date are performing only individual techniques. So what I would advise each one of you is that you should visit a hair transplant clinic who are performing all the possible techniques of hair restoration, and only then take an unbiased decision based upon the pros and cons of each technique that has been explained to you. I hope I have clarified all your queries concerning FUT and FUE and which is the right technique for us. If you have any further queries or concerns, please feel free to contact the number given below. Thank you and wishing you all the best.